Welcome back to Main Street Living. And I like to say these are the times that we cannot forget about our seniors, right, Cheryl?
Absolutely, Quincy. It's so important. And with COVID-19, everybody is trying to stay safe, but we have to work especially hard to keep our senior community safe. And I want to bring in our next guest. Her name is also Cheryl Wilson. She's an RN and CEO of St. Paul's Senior Services. Cheryl, welcome to Main Street Living. I already like you because we share the same name.
Thank you. Yes. Strong women, strong name.
Absolutely. Absolutely. So tell us about St. Paul's Senior Services and what exactly it is and what you do.
St. Paul Senior Services has been in San Diego on Bankers Hill for over 60 years. And we started out in residential care. We added health care. We added assisted living. Then we added daycare programs for Alzheimer's and for childcare. And then we added PACE, which has turned out to be one of our largest programs. We serve over 1,000 seniors who are very frail, very poor financially, and live in substandard areas. And so we take care of those people in their homes. We also have a skilled nursing facility, and we have about 47 vans on the road at any time, picking up people, taking care of people. And we're very proud to be a leader in senior care in San Diego.
Wow, that's a lot of responsibilities there. And I know when COVID-19 hit, I mean, nobody was really expecting it to turn into what it is now. How are you keeping everybody safe?
Well, at St. Paul's, I think maybe because I'm a nurse and because we have physicians on our payroll and we have 2 medical directors, we were ready for this. And so before the national lockdown or the county lockdown, 2 weeks prior, we actually had decided to lock down. And so we closed our facilities and we started talking to our employees about sanitation and prevention and care, which they all knew anyway. But we started talking even more with people who weren't our usual caregivers, not our usual nurses, but our drivers and our maintenance people and our grounds people, talking to them about their personal health, sanitation, caring for themselves, and keeping infection out of our buildings.
That's so true. And I know it's got to be really tough to do. And you want to do a lot for your staff as well and make sure that they are safe and well. And so what else is going on with your staff? And then moving into summer, what are you going to do as a lot of businesses start to reopen?
Well, we can't care for our seniors if we don't have our staff. So we recognized that very early on, and we started to provide certain benefits to our staff. We closed our normal childcare. We locked that down. We closed it, but we reopened it for our employees because the schools closed down. And if they had to stay home with their children, they couldn't come to work. So we opened up our childcare program just for our employees. We also started offering our employees meals because if they had to leave the premises to go and buy something at the local store or the local restaurant, that was a chance for them to become infected. So we started providing meals to them. We also, for those people who were caring for anybody that was suspected of COVID, we offered them hotel rooms to stay in. We also provided weekly communication, daily education, fitting for masks, the very special N95 masks, showing housekeepers how to use gowns and gloves and masks and visors. We also showed people, as I said, that our drivers and maintenance people, how to use disinfectants safely. But we really wanted to take care of our employees. We started screening at the front door, temperatures, asking questions, making sure that our employees were healthy and well when they came to work, and asking them to stay at home also so that they could prevent catching an infection if they went to the store. So that was a challenge, but we have risen to the challenge and our employees have really appreciated it, I believe.
Wow, you are going above and beyond, and your facility sounds like an amazing place. And quickly before we go, anything else you want to share?
We have had no COVID-19 cases in any of our residential facilities. In our PACE program, we've had very few for people who are living at home, and those few that we have had have been going to other programs and have brought it back. So we are caring for them. We're doing our own testing. We don't rely on the county for anything. And we are here for our seniors because you know what? it's been 2.5 months before anybody ever recognized that seniors were a vulnerable population and needed to be cared about. We got no PPE, we got no support, and we really had to do it ourselves. And so I congratulate all the long-term care providers in Beaver County for what they have done to keep our seniors throughout the county healthy and well.
Cheryl, I really applaud you for all you are doing, and I send you all the best and all my prayers. Thank you so much for joining us.
Thank you.